Israel is still fighting wars on multiple fronts, but a quieter crisis is deepening within its military after nearly 2 years of war in Gaza and sustained deployments across Lebanon and Syria. New official data points to a sharp surge in mental health disorders and suicide attempts among Israeli soldiers. Here's a report.
Israel is facing a deepening mental health crisis within its military ranks, one fueled by the longest and most intense deployments in recent decades. New data from Israel's defense ministry and major healthcare providers reveals a sharp rise in psychological trauma among soldiers and reservists since the Gaza war began. Official figures show that since September 2023, post-traumatic stress cases among Israeli troops have risen by nearly 40%. Defense officials warn that the number could surge by as much as 180% by 2028. The warning comes as Israel remains engaged on multiple fronts. In Gaza, along the Lebanon border, and in Syria, with tensions again simmering with Iran, for the Israel Defense Forces, the war has become both a battlefield and a psychological test. The scale of deployment has been unprecedented. Over the past 2 years, Israeli forces have fought a prolonged ground war in Gaza, clashed repeatedly with Hezbollah in southern Lebanon, and maintained operations in Syria. Israeli officials say more than 1,100 service members have been killed during this period. The impact on those who survived is now clear. The Defense Ministry says that of more than 22,000 troops currently receiving treatment for war-related injuries, around 60% are suffering from post-traumatic stress. Healthcare provider Maccabi reports that nearly 4 in 10 military personnel under its care sought mental health support in 2025. More than a quarter reported symptoms of depression. The crisis is also visible in suicide data. An Israeli parliamentary report found that between January 2024 and July 2025, at least 279 soldiers attempted suicide. A sharp rise from previous years. Combat soldiers accounted for nearly 78% of all suicide cases in 2024. Mental health professionals say soldiers are grappling with 2 overlapping forms of trauma. The first is fear, a constant fear of death that often persists long after deployment ends. The second is moral injury, the psychological damage caused when actions taken in war, even under orders, clash with deeply held moral beliefs. Trauma specialists warn the delays discourage many from seeking help. The Defense Ministry says it has expanded mental health budgets, increased staffing, and widened access to therapies. But demand continues to outpace capacity, and the pressure is unlikely to ease. With regional tensions rising once again, the risk of further escalation remains real. For Israel's military leadership, the challenge is no longer just winning wars, but preventing a long-term psychological collapse among those sent to fight them.